Question: A 60-year-old woman presents with gradually progressive difficulty in initiating movements, along with a shuffling gait and reduced arm swing. On examination, she has rigidity, bradykinesia, and a stooped posture. Additionally, she displays a resting tremor that decreases with voluntary movement. What is the most likely diagnosis? A. Parkinson's disease. B. Essential tremor. C. Huntington's disease. D. Wilson's disease. The most likely diagnosis for this patient with gradually progressive difficulty in initiating movements, shuffling gait, reduced arm swing, rigidity, bradykinesia, stooped posture, and a resting tremor that decreases with voluntary movement is A. Parkinson's disease. This patient's clinical presentation, including the combination of bradykinesia, rigidity, resting tremor, and characteristic gait changes, is highly suggestive of Parkinson's disease. Here's the rationale for choosing this diagnosis. Tremor and bradykinesia. The resting tremor that decreases with voluntary movement, along with bradykinesia, slowness of movement, are hallmark motor symptoms of Parkinson's disease. The tremor in Parkinson's disease typically presents at rest and diminishes with purposeful movement. Rigidity and postural changes. The presence of rigidity, manifested as increased resistance to passive movement, and a stooped posture are common features seen in Parkinson's disease. These motor symptoms contribute to the characteristic gait changes observed in this condition. Options B, C, and D are less likely in this case. Essential tremor, option B, primarily presents with action tremors, typically involving the hands, head, or voice, and does not typically present with bradykinesia, rigidity, or characteristic gait changes. Huntington's disease, option C, is characterized by chorea, a movement disorder involving brief, irregular, unpredictable, non-stereotyped movements, and it does not usually manifest with the characteristic resting tremor, bradykinesia, or rigidity seen in Parkinson's disease. Wilson's disease, option D, is a genetic disorder that primarily affects the liver and brain, leading to copper accumulation. While it can present with movement disorders such as tremors, the combination of symptoms described in this case is more indicative of Parkinson's disease. In summary, the patient's clinical presentation, including the specific motor symptoms and the characteristic response of the resting tremor to voluntary movement, strongly supports a diagnosis of Parkinson's disease. Further evaluation and management should be conducted in accordance with the standard of care for this condition. In summary, the patient's clinical presentation, including the specific motor symptoms